Welcome to Conversations with Laurel, everyone. I am your host, Laurel.mchargue, and today I have a fun guest with me. His name is Jared Knappe. Jared, welcome.
Thank you for having me, Laurel. Appreciate it.
You're welcome. I met you because I was having issues that I think a lot of people out there might be having too, right? Um, it's we call it TMJ, TMJ disorder, and you happen to be a physical therapist specializing in it. So first of all, tell me what inspired you to get into physical therapy and specifically with this disorder.
Yeah. I've always been intrigued. Physical therapy first was sprung on me when I kind of discovered my passion for exercise. Really, that's kind of how it stemmed from. I just found our bodies very incredible, and very adaptable, and with exercise, the adaptations that take place really intrigued me, and that led me to study exercise physiology. And then I decided that I wanted to take all of that I was learning and apply it to a one-on-one basis, try to help people apply that to their lives that were maybe having issues that kept them from applying that knowledge to their lives. Pain always gets in the way of things.
Yeah.
And so to be able to accompany someone through of that journey when they're not able to do what they love, or even able to do something as simple as eat a carrot, right? It's that can really wear on you. And I had a very great PT accompany me through a knee injury, and it just clicked, and I was like, that's what I want to do. And the TMJ stuff came from one of my mentors in graduate school at CU. He works with orthodontists, oral surgeons, dentists, the whole likes, and he came and did our temporomandibular dysfunction talk. And it is a joint like any other joint.
Yeah.
It has a disc in it. It glides, it moves, it should rotate properly. and
Should.
and and I noticed a lot of people, PTs specifically, when it came to the jaw, were a little bit hesitant to like dive in there and you know stretch it out and treat it like any other joint. And I was like, I'm not going to do that. I want to be, just dive in head first. And like, if you have to have your thumb in someone's mouth, if they're okay with it, it's all good. Like, it's healthcare at the end of the day. And to not be able to do something as simple as, eat a salad, right? That's a huge
Yawn.
quality of life. Yeah, it's a huge yawn. It's very boring. um, and yeah, so I decided to take a few courses on it, and specifically dry needling for the jaw to help release trigger points is
Yeah,
something
yeah.
that I specialize in as well.
All right. So I have to tell you, when I have had this disorder for a long, 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 long time, decades probably. And I have to give credit to my dentist, Dr. Lance Schamberger. He works out of Leadville, and he's the one who suggested to me, maybe try. Have you tried physical therapy? For this. And
Mm,
again, anytime I go for a dental thing, it's quite painful, and it takes longer because of the
mm,
issue with being able to open my mouth wide and not be in
sure.
pain. And so yeah, that's when I looked into it and found you. And honestly, I was very skeptical. I was thinking, how could this help at all? I mean, I think first of all, the cause of TMJ is having to say temporomandibular joint disorder. I think having to say that.
It's the hardest part.
That's the hardest part. So let me just tell you people out there already, and I'm going to ask you some more questions, but I am a total believer right now, and we'll get into what you do. But go ahead and describe some of the stuff you talked about. If you have to stick a thumb in someone's mouth, you're going to do
Sure.
it. Talk to them about what you put me through, what you would put someone through for temporomandibular joint disorder.
Yeah, so at first we just simply look at how is it moving? What's the quality of your motion that you have at that joint? It specifically is a hinge joint, and it also glides forward and back. So that's kind of how it's classified. A lot of times, say you've had a dental procedure and you're already predisposed to having perhaps trigger points in the muscles that help you chew, and you have to have those stretched for a long time during a procedure.
Yeah.
All of those muscles are kind of put on their maximum length. Um, it can certainly trigger spasms, and then it's what leads into the some people have popping, some don't. If I recall, you did have some what we would call maybe some subluxation, so the joint kind of will pop in and out a little bit,
Yeah.
um, and that comes about because one side is being stretched more than the other, and it causes an early subluxation. So what we do is we look at which side is maybe doing the popping, or is it both sides potentially, but usually it's one side that's worse. And when you open your jaw, it will deviate towards that side. It's like kind of telling you like, hey, come, stretch me out, come help me like keep up with the other side because I'm getting pulled too far here. And so when we see that, we of course use hands-on techniques to release the muscles on that side. You can pull that joint apart. We call it distraction. So that is when we would stick a thumb kind of in your mouth along the bottom row of teeth and grab your mandible, essentially like a grab it like we call it a pistol grip because
Yeah.
it's kind of looks like you're holding a pistol.
Yeah.
And then you stretch it and pull it out, tilt it, and help that joint create some more space in there. The dry needling is also used to, I think we did that a couple
Yeah.
times,
Hmm.
specifically for, I find it to be most helpful for a muscle that helps move your jaw side to side, and that's your pterygoid. So we treat that. And then after that, you don't want it to just resort back to where it was. So we give you kind of coordination exercises, which can be feel a bit funky at first. Pushing around on your jaw, helping it stay stable, learning to contract all those muscles properly again is a big part of the rehab as well.
Yeah.
So
Isometric exercises, right?
yes.
Pushing against. So, um, w- physical therapy is not a quick fix, is it?
No, no, very much so. It takes a lot of dedication. And we prescribe these with the expectation that, they've been studied, but it's important to know that these people in the research studies do them every day, right? And if there isn't this integration into your day, at least for a little while, it's hard to know if PT will really actually work or not, because a big part of it is um, that slow burn and correction of those patterns. Yeah.
It's so it's not, and in some cases, it's not a fix at all. In other words, what you do in physical therapy doesn't cure the issue, but it helps you um, deal with it. It helps you be able to. I can now yawn without being afraid. Without seriously, I can now bite into an apple, which I couldn't do
Mm,
before because the pain was too great
yeah,
with that motion. I couldn't do that before. I can now do
that's
these
great.
things that I wasn't able to do before. And I recognize that I have to do this for the rest of my life,
Hmm.
really. And so, the way
Yes.
I handle it is, it's typically every evening. If we're watching TV or, just the end of the day, or if I'm driving, I'll do the isometric, the pushing on either side,
Yeah.
the down, the forward, and then, well, not when I'm driving, but the stick of my thumb in there and kind of feeling this joint, feeling it open a little bit.
Hmm.
Um, I'm wondering, so like with me, the right side was worse. It could it be because I was mostly chewing just on my right side? I mean, is this something that, like, should
Yeah.
people think about how they chew and swallow?
It absolutely, yeah. Sharing the load, so to speak, between each side. That starts to become more and more rare as you have more and more pain, right?
Yeah.
You decide not to chew in ways in which it hurts. Um, Over time, just like uh, I'm being a runner, I always have running analogies, but um, if I were to have a tweak in my ankle, right? If I don't take care of it and treat it properly, I could very well end up limping on that foot for all my runs. That could lead to another overuse injury. Um, so it sneaks up on you a little bit. Our bodies are very good at finding ways around pain, and
Hmm.
it's not always the most effective solution. It works short term, but long term, you're right. It's how do we take dysfunction and maximize your capability of dealing with that so that you can still do all the things you need to do,
Yeah. Or
even
want
if
to
it
do. Yeah.
doesn't, yeah, even if it doesn't change. Let's say, if you have some arthritis in your joint, well, you can really, learn a lot of tips and tricks to help you manage quite well without just jumping right to, I'm gonna have surgery and have them scrape it out, right? It's good to try these options first.
Yeah.
Yeah,
Do some people need surgery? I mean that's something that I've heard of. I can't even imagine what that would be. What would that be if say I just was in so much pain still and none of what you have me doing is working. What would be
right.
the surgical option?
Yeah, let's say you were still having significant episodes where maybe your joint dislocates very easily. We have a disc between the two joint surfaces.
Yeah.
It's made of cartilage, and it's kind of like a cushion. We have we have muscles that attach to that disc as well and help it glide forward and back. But sometimes it can get stuck out, meaning it's no longer protecting the joint surfaces. And I have seen that one time, and I did refer that person to an oral surgeon, because if it gets locked, it will actually cause your jaw to really lock up, and you can't really open it or bite down. It's like you're just stuck in this middle ground, and sometimes people need a little bit more invasive options to help with that. It could be medication or an injection at first. Sometimes you can bring the inflammation down and try to get that disc to pop back in. Um, if the arthritis is really bad enough, they will do clean outs, little scope like clean outs to try to soften the joint surface as well. If there's bone spurs, and stuff like that, they might take those out. But
So how do you determine if the disc is out or not where it should be?
yeah, so there's a significant amount of clicking, and if they can't, uh, if you go to have them open and they can't, their opening is quite limited.
Which
What
mine
that,
used to be. Yeah.
yeah, sometimes it's muscle, fascia, you know, joint restriction, and we can fix that. Sometimes if it is this disc issue, like they would usually report like 3 days ago or a week ago this happened and it's been stuck for a week. If I hear that, I'm kind of thinking like, oh, you might have you might have dislocated your disc in there, and we need to make sure that's not the case. And so they could report mostly just inability to bite or open. And if you go to move it, it will be very, very painful,
Okay.
to occlude or to open. Either one. Yeah.
All right. So in addition to the, the isometrics, that I could do, just with my hands, you suggested getting a couple of adult chew toys, which you call them
Yes.
adult chew toys. So like I've got this pack of three different um, consistencies of, a bite thing that you just kind of
Yes.
hold down on and repeat, which I guess helps you bite in a coordinated way, in an even way.
Yeah.
Um,
It's most effective after you've worked on correcting your, when we worked on correcting your bite, right? And we know that your muscles might be prone to getting some trigger points or getting overtaxed very easily. It's a way to help condition the muscle. Basically, if you're a chewer, like overnight, if you're really, that's a big common thing. People bite and kind of grind
Clenching.
their teeth,
Yeah.
clench overnight. Um, though that will often irritate the muscles, right? So too much is not a good thing. um, but once we get things loosened up, if you are a clencher, if we exercise the muscle a little bit, it's less irritable usually. After a night of, say, you're more stressed than usual and you clinched that night a bit, it should not cause as much dysfunction the next day.
It seems a little counterintuitive that you would be biting down on this thing, if you have a clenching issue, but it seems to be helping. Now I got to tell you, this other thing that you had me get, this
Yes.
this thing.
Yes, it helps you open your jaw, right?
This is a little scary, okay? Now,
Yeah.
I thought it was going to be a soft rubber, and I won't tell you what my husband said this looked like. But anyway, I
Yes.
haven't I just got this, and it's a little scary. So you basically bite on it, and then you twirl, and it opens your jaw.
Yeah, almost
And
like a horror movie, right?
yeah, it absolutely is. And it's, I guess, meant to just kind of be able to open it to a point and just and have the muscles relax there,
Yeah, and
uh,
stretch. Yeah,
and stretch,
exactly.
and stretch.
Of course, like um I the body is really effective at adapting if you give it bite-sized pieces, no pun intended, but if you if you expose it gradually to something, it can adapt. But at the dentist that one day, right, you had your mouth open for probably who knows how
So
long.
long. Oh
Yeah.
yeah, anyone who's had a crown or a root canal
Right.
knows that you're
Um,
you're in there for a long time.
yeah. And so that is much more than a bite-sized piece. But
Yeah.
if we can do maybe even 2 minutes or less to start, right, of stretch and then take it off and then stretch and then take it off. That's kind of the idea.
Yeah. So okay, I'll work on this a little
But
more.
it's not, it is by far and away not the most important part of your rehab, right? It's hopefully a way to decrease the threat of any future dental procedures.
Okay.
um,
All right. Well, what's the
but
most important? What's the most important part?
oh, all the stuff you're already doing, the stuff we did together, and then your daily exercises probably would take the cake.
Yeah, the isometrics, yeah. What's your biggest frustration with patients?
Oh man, I mean, PT's different every day. Everyone's different in their pain tolerance, their stress levels, what they do for a living, their approach to pain. They might be much more fearful, or they might be like more of a confronter. I would probably we talk about people being confronters or avoiders in terms of pain,
Huh.
and that can be a really strong indicator of how rehab in general, especially low back pain, but how rehab might go for that person if they tend to get very anxious and very nervous and fearful of pain, or if something hurts but you still go about your day because you need to and you want to, or does it cause you to just want to kind of sit on the couch all day? If you're someone who confronts it a bit and you're like, well, I still need to do X, Y, or Z, I'm just going to kind of slowly ease back into things, your prognosis is much better. So I think the hardest thing in PT is helping someone overcome a a fear of pain that starts to really, they've done studies on this, it starts to smudge your sensory areas of your brain if you go long enough having a fear of a certain movement, um, and your brain becomes like on hyperdrive for certain things that used to hurt, and it makes you not want to do them, of course, but it also will inhibit muscles from firing properly if that is allowed to stay. And so once, if that's gone on for a very long time, I would say the hardest thing is someone who has had pain for 20, 30 plus years, and has decided they just want to cut, they have cut out things of their from their life for that long. It's very hard to um, try to help show them that, this is not how it has to be, like, and that's a hard thing to comprehend, I think.
Yeah, yeah. I never thought I could bite into an apple again. And the first day I
Yeah.
did, it was like, yay,
Yeah.
yay. This is I'm going to do this every single day for the rest of my life because I want to be able to bite into an apple and yawn without being afraid and, eat a whole salad without my jaw locking, which it used to do.
Yeah.
And yeah, but again, I know I have to do this every day for the rest of my life, and I'm willing to do that because, the alternative just is no fun.
Is not fun at
It's
all.
it's it's
Yeah.
not it's not fun at all. So, what else are you working on? What else do you help people with other than the temporomandibular joint disorder? What else do you do?
Yes. Well, it's actually quite linked, quite related to the neck. I'm trying to think back if you had any neck troubles in your rehab. But
I do.
yeah, they kind of like to walk hand in hand, jaw and neck pain. And that surprisingly actually is because your neck posture does impact how your teeth occlude. So if you have a kind of, forward head posture, your head's out in front of you and you bite down, your teeth will compact in a different spot than if you are a bit more upright. Because your jaw is kind of hanging beneath your skull. So you change the neck posture, you also change your bite. Um, and so neck pain, headaches, and jaw are kind of my specialty. In addition to people who are dizzy, so I have a vestibular certification as well. So I work with people that are dizzy.
Inner inner ear things?
Inner ear dysfunction, yeah. BPPV,
What's
which is a
that?
common one, that's benign positional uh, paroxysmal vertigo. So it's something that you get vertigo, rapid onset when you change your head position. When you lie down at night, when you roll over, when you rotate your head quickly, it triggers this kind of motion like you're on a carousel.
Okay, ooh.
Um, Makes you nauseous, of course, and um, PT can help help a lot with that, and actually quite quickly. It's one of the few things that actually most things I give people, I'm like, you're going to do this for the rest of your life if you want to maintain the gains that we've made, right?
Yes.
But with BPPV, it's a bit more kind of, 1 or 2 sessions can make a huge difference, and they actually don't have to continue doing the exercises for life because you get rid of the crystal that's in their inner ear. I know that sounds like really weird, but it is a thing, and anatomy and physiology.
Yeah.
Uh, yeah.
Uh,
So that's my other.
I have a nephew who I've heard stories about the rocks in the ears, the crystals in the ears, being
Yes,
misaligned. You're saying that there's an actual fix for that?
there is. Yeah, and about 30, if I remember correctly, about 30 to 40% of cases can just spontaneously get better. Um, This is specifically with vertigo when you move your head, right?
Okay.
If it comes on out of nowhere, it could be something else entirely. It could be a tumor on your vestibular nerve. It could be a lot of other things. So
Okay.
always, I recommend people go to their doctor, right? Get assessed by their physician, or if it's really bad, go to the ER.
Would that require, in order to determine that, how would they would that be an MRI? Would that be a CAT scan? How would that be determined?
Yeah, there's lots of different clinical tests you can do. So watching someone move their eyes, and if you have an insult on only one side, you can see the eyes do what's called a saccade or a catch-up saccade. Your eyes will maybe have some nystagmus, which is when they twitch, and that's a sign of dysfunction in your inner ear. And
Huh.
so you can localize it to one side first. If that's the case, then it's probably not that you're having, a stroke, which is a good thing. But there are ways to determine, is this a brain issue? Is this like a stroke that they're having, or is it their inner ear? That's the first kind of step you want to take.
Yeah.
And CT angiogram. So yeah, you mentioned CT. Doing a CT angiogram and an MRI is pretty standard. You want to have those images taken, yeah, and that can lead you to the next kind of step.
Yeah. One thing I forgot when you were talking about the neck, one of the things you were doing was you were working on these cables,
Yeah, the
these neck cables.
SCMs.
Talk about those neck cables.
Yeah, your
What do those do?
your sternocleidomastoid. It's a fun name to say. So that muscle helps you side bend and rotate your neck. It also in a way is it helps you breathe. So it's an accessory muscle for breathing. Um, it's one that so it does not help you bite, but it does help you stabilize your neck. And the attachment point, it attaches right here behind your ear on your mastoid process. And fascially speaking, there's a lot of crosstalk between that area and your jaw. So why we work on that muscle is especially if you have headaches in association with your jaw pain. This muscle basically pulls on your skull all day, and so if it's hypertonic or spasming, it can cause kind of a headache. So we address that through, grinding it together between your fingers, pulling on it, stretching it, all that good stuff.
Yeah, it's not exactly comfortable, but
No.
kind of like what the pressure point stuff. And I do that too. I like in
Yeah.
that joint area, I press on that too and kind of feel how
Yeah.
it's moving. And after a while it feels like I should do it more. And so I do.
Mm.
But the bottom line is I am so pleased with something that I totally had no confidence in, to be honest. And
Yeah.
my life has changed because of, what you helped me through and what I'm going to do for the rest of my life. And, I hope people out there will consider this. So, anyone listening to this who has jaw pain, TMJ, clicking, locking, whatever, how do they get to see someone like you? I mean, I'm lucky. You're right here in
Hmm.
Salida, Colorado.
Yes.
But how would people get, this kind of help?
I have been very pleased with a lot of the dental offices in the valley where we live here, the Arkansas Valley, do quite a good job of mentioning it. If someone has continuous jaw pain, either in their history or after a procedure, like Salida Family Dentistry, like we get referrals from them. Um, and we've done a little bit of marketing. I think we probably could do more to try to help get the word out there, that you don't have to live with this pain. It's not normal. It doesn't have to be your normal, right?
So people
Um,
in California and Massachusetts and Michigan and Florida, they should hopefully have, first of all, a good dentist that they trust. Um,
Yes.
and then hopefully their dentist is
Yeah.
aware of, TMJ physical therapy.
Yeah, and most times you actually don't need a doctor's order to get worked up by a PT if it's at a private practice. Um, Colorado is one of those states. There are a couple states that don't have what we call direct access yet, meaning you can't just walk up to a PT's office off the street without a doctor's order. But largely it is the case. So you can do some searching online for private practice PTs in your area. Specifically, all PTs get some training with the jaw, um, but ideal if someone has done a little more continuing education, of course. But yeah, you can go through your primary care doctor, your dentist. They can refer you to someone that maybe they know has helped patients of theirs in the past. Word of mouth marketing there. So yeah, it's a good way to go.
All right. Jared Knapp, physical therapist for temporomandibular joint disorder and more. Are there any final things that you would like to tell our listeners out there? Stop chewing gum. I mean, don't eat hard candy. Don't chew on ice. What other, what other like preventative if you don't have this issue, what should you not do?
Hmm. So I think the biggest piece of advice there, when you're young, you get a huge burger, right? You
Yeah.
don't think twice about chomping into a massive sandwich.
Yeah.
But what I would say is probably it's a good idea. What we see is it's largely a good idea to work on controlled, what we call controlled opening. So feeling right by your ears, right? So if you don't know how to palpate your TMJ, you go just in front of what's called that tragus of your ear. It's a pointy part of your ear that's cartilage.
Yeah.
You go till you hit bone, and that's your zygomatic arch. You go just below that, and that's where you can feel your jaw, your TMJ joint moving.
Mhm.
If you work on opening as far as you can before you feel that jaw joint pop forward, and try not to go beyond that very often, that's actually protective. So working
Ah.
on opening your jaw, but not just letting it pop around like crazy. So that can, if you're predisposed to disc issues like we talked about, the more you let it pop forward and back, the more wear and tear that disc will likely take. So when you're young, you don't really think about it, but as you go through life, I think it's good to practice controlled opening. So that would be my probably one tip. Yeah.
All right. Well, thank you so much for visiting with me today and you are so knowledgeable in all this. And again, I appreciate you so much and what you've done to help me. And yeah, for those out there just listening, talk to your dentist if you're having this issue. Look for a physical therapist in your area who specializes in temporomandibular joint disorder. And, like me, you don't have to suffer for the
Yes.
rest of your life. But again, it's a commitment. It's a commitment to doing the exercises every day, which we ought to do for all of our joints, right?
Yes. They all need some love. That's for sure.
They all need some work and some gentle movement and to keep moving. So again, thank you
Yes.
so much, and
Of
I hope I don't
course.
have to
Yeah.
see you again.
I
Uh,
that's
but
always the goal.
that's always a goal. Well, I
Unless
don't.
we're at a pogo stick competition. Yeah.
Did you get your pogo stick?
I looked at the one I will buy, but not, yeah,
All right. Well,
that's
that's
awesome.
a that's a
Whole other
whole
story.
different story. Anyway, listeners out there, if you enjoyed this episode, please like and subscribe, and come back next time when I'll have another fascinating guest. Jared, thank you, and I know you have to get to work,
Welcome.
so I'll let you
Yes.
go, and well, maybe I'll see you around town, pogo
All
sticking
right.
around town. All right, bye.
Sounds good. Thanks, Laurel.